Good evening, ladies and gentlemen. Thank you for joining me for another episode of Campbell Talk. I'm your host, Richardo Jackson, founder and president of Campbell Health Solutions. Please go onto our page on Instagram, Facebook, YouTube, TikTok, and like us and follow us. And we have tons of great information. Campbell Health Solutions is our handle. We have tons of great information, and you can catch up on some of the past shows. We have a show every other Monday night at 6:30 p.m. So you can set it on your calendars, or you can go back to our Facebook page and YouTube page and be able to watch the previous episodes that we've had. And you can set your calendar, set your reminders there. So please like and share. Get invite folks to watch because tonight we have Earl. I'm saying back up again, Dr. Earl Benjamin Robinson out of Louisiana, and he is going to be joining us in a few minutes, and we're going to be talking about HIV and the Black community and what we can do so we can stay healthier and stronger together. In addition to that, he'll tell you a little bit more about himself and kind of like all of the things he has going on and all the different ways that he is having an impact in our community. And just in case you missed it today, know that today, February 7th, is Black HIV/AIDS Awareness Day. And so we want to encourage each and every one of you out there watching this to go and get tested. And I know it's 6:30 and you might say, it's already passed and the day is already done. But I want to just expand this day into an entire month. Okay. So I want you to go out there during the month of February and just get tested. Know your status and stay safe. And if you're a person living with HIV, you can do what you need to do so you can stay healthier longer. You don't have to die from HIV, and you can take medication and live a long, healthy life. You can have, keep your goals, get your goals together, get your goals back on track. You can do whatever you want, but you have to know your status and you have to be able to take care of yourself in order for that to happen. So I want you to go and get tested. If you don't know where to go get tested, please reach out to us at 561 863 867 1057. 561-867-1057, and we'll help you to find a testing location near to you. Again, thank you for watching, and we'll be right back with our host, our guest, and we'll see you soon. Good evening. Dr. Earl Benjamin Robinson, are you there?
Hey, Mr. Jackson, how are you doing?
I am doing great. I just want to remind our viewers that if you have questions throughout this show, please type them into the message box. We'll do our best to get them answered on air. And absolutely feel free to ask any questions you'd like. And also remember to like, share, and subscribe.
Just note, I am not a MD. I am just a doctor of health sciences, and I'm a public health practitioner. And so if we have any medical questions, I will not be able to answer them unless they're very basic health science questions. But just wanted to clarify that I am not an MD. I'm not a medical doctor. I'm a doctor of health sciences. And so I implement programming into environments and organizations and into community. And so that's my area of expertise.
Awesome. All right. So tell us a little bit about yourself.
So I am Donald and Mary Miller's son. And I am Michael's husband. and I am the uncle to many nieces and nephews. And so I am the founder and the one of the primary uh, principles of the Bach Group. The Bach Group, Bach stands for Behavioral and Community Health Group. The Bach Group is more or less a consultation firm that really is centered around building the capacity of people, populations, and communities and organizations. Um, in an attempt to improve health outcomes for people. We have been in existence since 2015. We have contracts with the University of Houston. We have contracts with My Brother's Keeper via the Centers for Disease Control. We've had contracts with many Ryan White programs and HIV/AIDS prevention programs. We are centered in our work is centered in helping to build people's capacity to be well and to be whole, and to also build the capacity of people providing services to people, populations, and communities, building their capacity to better meet the needs of the people that they serve. And so, if you want to know some more information about the Bach Group, you can look us up on the web at www. Uh, uh, dot the Bach Group, THEBACH group.org.
And we're gonna try to get that added into the post, and then we'll pin it just in case people want to be able to access that. I believe you can type it in the comment,
Okay,
so
I'll do that.
and then I'll pin it for you.
Thank you.
All right. So and the Bach group is based out of where?
It's based out of New Orleans, Louisiana, but
Whoop,
we
whoop.
have contracts with individual organizations around the nation.
Awesome. Yes, and so for folks who are interested in learning more information, in just a second, he'll be posting the website inside of the comment section. We'll pin that up for you so this way you can access that. And as you know, that's part of how and why we do the show, is because we want to make sure that our community have access to the resources that are available that they don't generally know about. And so by bringing that to you, now you are able to access those resources, um, or at least learn about them. So this way, if you need them in the future, you can access them.
Right. Did that come through? I hope it came through.
Yeah, I'll post it for you. Okay. All right. So HIV has been like a big issue, like for a very long time.
Yeah.
So I guess, where do you think we are right now when it comes to HIV and Black and Brown folks?
I think we are in a place of constant up and down. Every so often, we'll make some progress, and then we'll get some CDC. We'll get some data from CDC that indicates that Black same-gender loving men are Black and Brown trans women are disproportionately represented in the new prevalence and incidence of HIV. And so, I mean, it's a constant state of up and down. And so, we have made tremendous successes in getting people into treatment. We are continuing to make successes in getting more people on PrEP. And I think, collectively speaking, we should all be very proud of them. But when you start to take a deeper dive and look at populations like Black people, Black LGBTQ people, Black same-gender loving people, Black trans people, and other communities of color, you see that we our rates are not stable, and they go up and down, and so there is a consistent um, uh, I want to what is it? The seesawing of the incidence of HIV for individuals in our community. So, we've made some progress, and we still have more progress to make. And so, PrEP has provided us a tremendous amount, a significant opportunity to combat HIV. And so I'm hopeful. I will remain hopeful. That's all that I can do is be hopeful that we use all the tools that we have to better support people in being well and healthy.
Yeah, and so much, so many information is out there, so many resources are available. Where would you suggest that people start?
Could you ask that question one more time?
There's so many information that are out there, and
Yeah.
so many resources that are out there. I mean, some of them are readily available, some of them are not, some of them are good, some of them are bad. So where would you suggest people start?
I would suggest that people start at the Centers for Disease Control in learning information. I would suggest that they also start at their local health department websites. I would also, since Campbell is here, your organization is here, I would also suggest that they reach out to you all and to others like you in the community who have a vested interest in HIV prevalence and incidence. And so I would start there in looking at what information is available on CDC's website, local health department websites, and organizations like yourself, like the Campbell organization, Campbell Health Solutions, to find out information about HIV and AIDS. And so I would think that, for me, that's what I would encourage people to do is to find out information from credible sources. And so sources that aren't biased in any way, and sources that are committed to telling factual information. And so I would start with CDC, the health department in their respective areas, the World Health Organization, and other research entities that they may be familiar with, or that may have relationships with many of the other organizations that I've mentioned.
So we have a question already. This question is from Nars Jackson. He's asking, do you think they'll ever come up with a cure for HIV?
I don't know. I don't know. We have made so many advances in the past few years regarding HIV. We have PrEP. Um, I know that we have that a study that's coming out where with the shot, and so I don't know. I'm optimistically hopeful that things will even get better than what the resources and tools that we have on hand now will even get better. Um, but I don't know if we'll ever get a cure per se for HIV. But what we have at the present is PrEP, and what we have at the present is if people are taking their medication 95 to 100% of the time, that they will be undetectable. We also know that individuals taking their medication consistently on time, they're living the same amount of life that anyone else who doesn't have HIV is living. And so, we may not have a cure. We may not ever have a cure, but we have right now, what we have right now is PrEP, which can keep aid people who are HIV negative and remaining HIV negative. And we also have entry.
Hello? I think your
I
audio
think
went
your
out.
audio went out. Doctor is saying as it relates to HIV, living with HIV, those individuals are living healthy, longer lives. And so we may not have a cure, but we have a tremendous amount of resources that can help us presently.
Awesome. Now, like I know that a lot of families are experiencing stigma and
Yeah.
discrimination, and people are experiencing stigma and discrimination. How can we I know there's so many different things that have been tried over the years. It's kind of like just like how can we really have an impact in that area?
I think by doing things like what you're doing, is in having creating a platform where information can be shared, and I think that's what we need to continue to do to help reduce stigma. I think individuals living with HIV, I think sharing their stories, because people like to characterize individuals who are HIV positive, are living, excuse me, people living with HIV. And so people being able to tell their stories, those who feel comfortable, more people telling their stories, organizations like yourself allowing for platforms for information to be shared. Um, I think those are just two things that I think are central to helping to reduce and serve as a counter to the stigma that's out there. The stigma that's out there, it's real, and it's born out of fear
Yeah.
and ignorance. And
Hmm.
so I think the way that we combat that is by standing in our truth, and by sharing factual information, and by supporting people who are living with HIV in being able to tell their truth, not and so allowing them platforms and safe spaces to tell their truths, so that people understand that this is just a chronic health issue. This is just a chronic condition that is manageable. And so the more we continue to tell that story, the more that we continue to talk about the availability of PrEP for people who are HIV negative and want to remain negative, the more we share the story or share information as it relates to people who are living with HIV, taking their antiretroviral therapy, their medications 95 to 100% of the time effectively, they will remain undetectable. The more that we continue to share those stories, I think those are the things that we need to do that can help to reduce stigma and discrimination related to HIV.
So I find that a lot of people still, after all this information, do not know kind of like how HIV is transmitted and how
Hmm.
HIV is not transmitted. So
Hmm.
if we can just pause for a brief minute and just run down a list of how it's transmitted and how it's not transmitted, so people can really understand, like, so we'll start with how it's not transmitted.
Well, let's start with how it is transmitted. Let's start
Okay.
there.
All right.
Okay.
So how
So
it is
H-
transmitted.
and I refer to it as, yeah, how HIV is transmitted by vaginal, a person having sex with someone who is HIV positive and unprotected, by having vaginal, anal, and oral sex, by sharing needles and syringes through the birthing process from mother to child. Um, those are the ways that HIV has the potentiality to be spread, by having vaginal, anal, and oral sex, unprotected sex, by sharing needles and syringes through the birthing process from mother to child. And so if you have a vagina, if you have an anus, if you have a penis, if you have a mouth, and you're using those things during sex, and you're having unprotected sex, or if you run the risk of contracting HIV if you don't know people's status, if you haven't been tested, um, if you are using needles and syringes, and you're not cleaning your works, and you're sharing those works with other people, you run the risk of getting acquiring HIV. And so those are the way that a person can acquire HIV, by having unprotected vaginal, anal, and oral sex with someone um, who's living with HIV, by sharing needles and syringes, um, and from mother to child. But that's why it's important, and you're going to hear me reiterate this throughout the session. Today we have PrEP, and again, PrEP is medication, and also the protocol for HIV negative people remaining negative. But most importantly, the medication can help keep a person from acquiring HIV if they do have unprotected sex. And then we also have effective antiretroviral therapies. And so, if HIV negative people want to remain negative, there's PrEP. If HIV positive people want to want to suppress the amount of HIV in their body, they can use the antiretroviral therapies to do that. And so we have so many resources that can help us prevent people from acquiring HIV. And so we need to lean into those resources. But HIV is spread by having vaginal, anal, and oral sex, and by sharing needles and syringes with someone who's HIV positive, and through the birthing process.
Awesome. Then, so now let's talk about it now. So how how do what are the ways in which HIV is not transmitted? This
Oh,
not
let's count the ways. Let us count the ways. It's not transmitted by eating behind someone who's HIV positive. It's not transmitted by laying in the bed with someone who's HIV positive, just laying there. I'm not talking about sexual activities. It's not acquired by living in the same house with someone, or breathing the same air, or being spit on by someone who you believe to be HIV positive. There's just so many ways that it's not. But the way that what we do know, the way that you do acquire it, by sharing needles and syringes, uh, by having unprotected vaginal, anal, and oral sex, and a mother to child during the birthing process.
okay. And I can tell you also
Hello?
HIV is not transmitted from using the same shower
No,
or sitting in the same car or
no,
from someone, you know, crying on your shoulder or for
no.
providing support, like breathing the same air. Like
No. And
so
it's, and we're 40, almost 40 years into this, and people are still believing that. And so the question that, that comes to mind for me is, uh, some people are, I believe, are emotionally invested in believing that. And because, again, it goes back to fear. And so fear will have you believing a lot of things, especially when you already have a negative perspective of or viewpoint of the people, of people living with HIV, or of people that you perceive to be living with HIV. And so there's a lot of fear and ignorance and misinformation that exists, and help to make it a perfect storm for people to just, stigmatize and discriminate against people who are HIV positive, people who are living with HIV.
and so the most important thing that someone can do is arm themselves with information.
Yes.
And I can just throw this little plug in there. That's kind of like what Campbell Health Solution does. So if you are needing some information, if you would like to just talk one-on-one so you can get information, or if you would like to provide education to your family members, or say, look, I would like you to sit down with my teenagers and we can do a virtual session, we are available to do that. And so you can reach out to us and we'll be able to set that up for you and help you to walk you through, answer questions, provide you with education, provide your family with education. So this way you can be better, you can be well, you can be informed. And so you're able to make healthier decisions when it comes to sex, when it comes to HIV, when it comes to knowing your status, when it comes to being with your partner and even discussing your status and discussing testing. We can help with all of those things. So absolutely, definitely reach out and information will be provided in the link. You can reach us, text us, email, plenty of form messages. It's all available there. So there is
Ricardo, there's one thing I do want to say, because I'm so proud of what um, Campbell Health Solutions is doing, because you're tapping into what people are utilizing to get their information. The fact that you have this session that we're well, I'm on my phone right now with you. And
right.
so, and a lot of people are using social media, and this is streaming on social media live. The fact that you are leaning into what people are using in their everyday life speaks to the value of Campbell Health Solutions. So thank you for paying attention to those social factors and those social determinants that, one, affect people's health, but also using what you know about those social determinants to develop communication mediums and messages so that people can get the information and help that they need.
Thank you. Really appreciate it. We are about impact. I've been doing this for 21 years, coming June this year, and I'm ready for it to be over. As our Max C from Palm Beach County, our minority AIDS coordinator in Palm Beach County, say, we are in it to end it, and part of the ending process is saying once we end HIV, she will be taking a vacation to Alaska, and so I think that all of our HIV prevention advocates, educators, doctors, I mean, once we end HIV, should get a mandatory like month-long vacation, all expense paid trip someplace.
Well, since it won't be happening anytime soon, yeah, I agree with all of that. So yeah.
Yeah. All right. So tell us, how are you making a social impact in your community or around in your neighborhood, in your state? How are you making that social impact?
Well, I think I make a social impact by speaking up, by using the privilege that I have as a Black, same gender loving man, um, by using that privilege to talk about, because I'm a person who is not living with HIV, but I make certain to make space for in the work that I do for people who are living with HIV. And so making space for individuals' voices and concerns and needs to be heard, I think, is one of the ways that I'm able to make an impact. By When I go into meetings and I'm talking about other health issues with the governor or with other decision makers or policymakers, making space to talk about issues affecting related to HIV and those populations that are perceived to be most affected by HIV. And so that's how I make my social impact by using my privilege, using my superpower of being a Black, uh, big, tall, a same and loving Black man, using what little privilege I have there to make space and room for people living with HIV and people thought to be most affected by HIV.
Awesome. And we really appreciate you for that and for giving up your time and energy in helping us to help ourselves. And I think that's kind of like what public health is all about, right? It's
Yeah,
not necessarily about fixing people or, like it's about helping people to help themselves because we can't fix people, but we can provide you with information so this way you can use that information to help yourself, to help your immediate family. And if we all take just one step towards that, then we can shift the way HIV is impacting our community for
we we
generations.
we can. I want to also just say, given what you just said, it's about empowering people to do what it is that they need to help themselves. But for some organizations, it's about some organizations also taking a responsibility for how they might be a barrier or how they might be contributing to the spread of HIV in communities. And so that's something that, of course, we want to empower people, but we also want organizations and institutions to be aware of their bias, to be aware of their actions in relationship to exacerbating or contributing to HIV prevalence inside communities. Because, of course, we want to empower people, but, sometimes organizations need to be made aware of, barriers that keep people from getting into care, barriers that do more harm than good, barriers that do not take into considerations the data and do not take into consideration that the social determinants of health that are exacerbating HIV
Yeah.
infection in many communities. And so, yes, public health is about um, aiding communities in becoming and individuals in being whole and well. But public health is also about social justice. And so, thus, it's also about making certain that we hold organizations accountable that are barriers to people achieving their ultimate and full healthy self.
And I think a lot of that too is stemming from organizations not really evaluating their programs and services regularly,
Exactly.
be able to
Exactly.
have that impact.
Exactly. If you are really trying to make headway with populations that are historically and systematically disadvantaged, which we know those populations are disproportionately affected by HIV. If you are not doing informal and formal needs assessments on a regular basis to in an effort to see how I need to be meet how I need to better meet the needs of my population, you're doing yourself a disservice, and you're also playing a very dangerous game that likely affects that contributes to rather the prevalence of HIV inside your community. By not doing needs assessments, formal and informal, ongoingly, you don't know what's going on, and
Mm.
so to still be doing the same thing that we did 40 years ago with this pandemic is detrimental. And so doing needs assessments and listening, not just doing them, but taking that information and doing something with it that informs how you operate based on the data is central. Because we can do needs assessments all day long, but we have to be doing something with that information.
Absolutely. Because you have to make sure that the community is involved. We can't
Yes.
go and be like, okay, here's the plan. This is what we want you to do. We need to get the communities involved. I
Yep.
mean, I look back at, you know, the history of HIV over the last 40 plus years, and you can see where, you know, when it was largely impacting white gay men or white folks, they got together and they pulled together and they put the resources together, and the rates in their communities got better
Mm-hmm.
because they were leading that charge. And when you look at Hispanic communities, they're pulling together and leading that charge, and their rates and the impact of HIV in their communities are not as detrimental as it is to Black and Brown to our Black community. So I think that we're at a point right now where we need more Black leaders to step up. We need more Black folks to step up, and we need to make sure that we create those spaces to have those impacts to drive the the methods and to drive the solutions that are going to have that impact in our communities and kind of like turn the tide on
I
the
agree. I
world.
agree. I think, one of the things, yes, the individuals in other communities, they've gotten together and rallied, but the but they were also given resources.
Mm,
And that's one of the areas that doesn't happen so equitably inside the Black experience inside the United States. Um, we'll our resources will very often come through other organizations. They will come through other communities, but they won't come directly from institutions or organizations within our communities. Part of that is sometimes, and just speaking very honestly, many organizations or partners don't have the they don't have the wherewithal to run or develop programs. But if they don't, the government needs to be providing support to those individuals to build their capacity, because it's been done with so many other organizations. And so we don't necessarily, one of the things, and this is one of my pet peeves, is we don't necessarily, as Black people, often have the resources given to us to combat this in a way that would create a dent. So that's one thing. But the other thing is too is that still, and you brought up this earlier, there's just still a considerable amount of misinformation that
mhm.
exists inside our community. There's still just a, a, a a considerable amount of fear that exists inside our community when it comes to HIV. There's still a significant amount of othering. It's not going to happen to me. It happens to other people that exist inside our community. So, you know, uh, fear, lack of resources, lack of federal and state partners providing real substantive and equitable resources in our community, I think are some of the things that are missing. And if we had those things, I think we would be further along in our HIV and AIDS. Um, we'll be further along in this process.
Absolutely. I agree. So thank you so much. I mean, we've shared so much information, and we've shared. I saw that the Palm Beach County Care Council actually came on the live and did a couple of shout outs. And so that is also another platform that is open for members or individuals who are living in Palm Beach County to be a part of, whether you're HIV negative or specifically if you're living with HIV. You can lend your voice to the process and help to create equitable programs and decide where funding goes
Yeah.
to help to make sure that we reduce for HIV in our county, that we stop new infections, that the money gets into providing services for people who need to access those services, and making sure that programs and resources are available. And so members of the Palm Beach County who members are people who live in Palm Beach County have access to this and can sign up and be a part of it. And if you need more information, you can definitely find them at. You can even just Google HIV Care Council and be able to find them. But if you have specific questions, definitely you can reach out to me, and the info will be inside the comment section. So Campbell Health Solutions, from time to time, we will have different guests on here talking about different things, and also on our social media platforms, we'll do different social media campaigns. And I'm pretty excited about what's going to come in March for, it's National Week of Prayer coming up in March. We also have Women and Girls HIV/AIDS Awareness Day. And so there are some pretty exciting things that are in the works right now. But we're getting ready to do some funky campaigns. We're we know that folks want to watch videos, and but they don't want to really do too much reading and they don't want to watch too much long programming. So we're going to show you our Pinky Promise campaign that Campbell Health Solutions put out last night. And so, yes, we know February 7th is Black HIV/AIDS Awareness Day, but we want to do a Black HIV/AIDS Awareness Month. So we want to continue throughout the month of February as we're celebrating Black history and ashe to the players on who we stand.
Yes.
Because if it wasn't for their, push and drive for equity and equality, and for us to be seen as equals and to not be incarcerated and fighting for justice and freedom, we wouldn't be here. So we stand on the shoulders of greatness, and salute all of our ancestors who have made the journey from Africa unwillingly, who were enslaved in America, and who have fought a system to and overcome, so this way the children and the children's children, us, can now live in a way that we can honor them and celebrate them.
Yeah, ashe.
All right, so I'm going to share with you our brief campaign. Here we go. See, it was that quick. It was that quick. So it actually went out on social media last night or this morning, I think. So we'll be pushing out some more stuff as the weeks go by, just encouraging people to get tested. So we want everyone, we're taking it back old school, okay? Pinky promise that you will go get tested. Know your status. It is 2022. There is no reason why you shouldn't know your HIV status. Um, and so if you don't know where to go, you can reach out to me, 561-867-1057. Reach out to me and I will help you to get connected to a testing site that is closest to you, because it's important for all of us to know our status. If you knowing your status is the beginning of taking the step to your sexual health and wellness. And so if you know your status and you're HIV negative, then you'll learn and know about what you can do to stay negative. And if you find out your status and you're HIV positive, then you'll learn and know what you can do to stay healthier longer and to protect your partners. So, with that, I just want to thank you, Dr. Earl Benjamin Robinson, for being on here tonight. This information was fire. I mean, this just goes all the way back to just what we need. I see comments here. Um, I'm gonna type it in. Felicia said, "Love it, love it, love it." Andrea said, "Love it, love it, love it." And we're gonna post the phone number again. I'll just do that. But I want to thank you for being on the show tonight and for providing us with this information, to helping us to stay healthier and stronger, and to be connected to resources and not misinformation.
Mm-hmm.
Okay. Any closing words?
Um, you know, do what you can. To your point you made earlier, our ancestors have persevered for us to get to this point. And, sometimes when we are trying to make a situation better, the only thing that we can, well, where we start is by doing what we can. And so in this battle and fight to combat HIV and to reduce HIV stigma and discrimination, do your part, and don't be a part of the problem, be a part of the solution. But do what you can, and start somewhere. And like I said at the beginning, go and learn some information on your health department website. I think you said, what is the name of the organization that was the Palm
Oh,
Beach County HIV Care Council? I'm certain that they have some information on their website, on the Campbell Health Solutions website. Go and find out all the information that you can, and start there, and
yeah,
make certain that you are not judging people or causing harm to people who are living with HIV, or those perceived to be most at risk for HIV. So do what you can do to make the world a better place.
absolutely. We do it together.
Yes.
If we don't work together, then we're not going to get there. We get there
No.
together. And so I posted the phone number in the website, and the website in the link. Of course, the phone you can call or text. So keep that in mind. And Palm Beach County Health HIV Care Council just posted the link also inside of the message. It's on the screen right now, so you can see discover.palmbeachcounty.org /care council /page. If you click the link inside of the comment, it will take you right there. You can also Google it. And then also, if you need to just reach out and we can tell you where you can go and get tested. It's about us knowing our status. So this isn't
Yeah.
about you have to come here or you go here. We want everyone to know their status. If you would like to become a member of the Palm Beach County Care Council, and you would like more information about becoming a member, please definitely reach out to Nita. Her number is also posted on the screen. Um, she will be able to provide you with all the information. She is the go-to person. She is the guru of all things HIV care council. She will get you the application. She'll walk you through the process. She'll tell you, get everything sorted out for you. So this is the best person right here. You can call her anytime. She'll definitely be, and she's always willing and able to help as much as she can to do what she can do to get you connected and to get you as active and ready to roll. So again, we want to thank you for being on the show. Really appreciate you, and thank you for joining us.
Thank you
If
for
you
having me.
Thank you. And if you out there in social media land, um, after this show, decide that you want to get tested or you want to know some more information on HIV, feel free to reach out to me. I will be available. You can text us, you can call us. We'll connect you with resources in your community, but we'll schedule you for educational session 101, either with your by yourself or with your family. So definitely reach out, and we'll be able to help. You can message us, inbox us, whatever it takes to get the resources that you need. We're here to help. Thank you again and have a wonderful night.